Good afternoon. It is Thursday, and we have an exciting program with for you today. We have Kelly Hight, and I'm going to introduce you to her a little later. But let's talk about a few things Alzheimer's Arkansas has going on. So first of all, just remember we do this every Thursday at noon, and we are always looking for the best resources. So if there's something you feel like you need or want as a caregiver, please contact us and we can see what we can do to provide you with that information. Our website is alzark.org. On the website, you can look at all the exciting things we have going on. Right now, we are gearing up for our virtual walk, and it is going to be September the 19th. From about 10 to noon, it is a virtual event. We do ask that you think about that you use the CDC guidelines as well as Arkansas government guidelines for social distancing and wear your mask if it's over 10. We will have some insight about that, but we are gearing up for that virtual walk. It is going to be exciting. We have a great platform to make sure all the teams will be visible. So if you would like information, just text RESPITE, RESPITE, to 71777, and you can get information about the walk. We also have another exciting text component, and you can text, are you ready, Zach? ALZARK to 51555 to get all the updates for Alzheimer's Arkansas. So we are getting ready to do a movie in Jonesboro. That date is going to be August the 22nd. We are so excited. These funds and these events is to make sure that we can provide resources to caregivers, make sure we can provide those grants that we are so known for providing and help so many people. To date, we have given out over $110,000, and we want to give out more, and we can only do that with your help. Some of the other things we're gearing up for is the Hope. It's in September. You'll get more information about that. So the workshop is the 14th through the 18th. So just mark your calendars, go to our website, look at our Facebook page, and we will keep you informed. So we're going to start with Kelly today. I'm going to really let Kelly tell you about herself and what she does, but she is Kelly Hight. She is the executive director for Hospice Home Care. Me and Kelly go way back, like, let's not say it like we're that old, but we go back, and she is really educated and understand the needs of caregivers. So let's bring Kelly in.
Hi.
Hey, Kelly, how are you?
Hello.
You look amazing. I like your lighting. I'm going to work on that. And thank you for volunteering your time and expertise for the caregivers across Arkansas, because we could not do this without you and people like you.
Thank you. Well, I appreciate you guys having me on today. I am excited because this is a program that we have started about a year ago, and I'm going to talk mostly about our palliative community resources. And Palliative Community Resources is a company inside of Hospice Home Care. So it is still all one company, but it's a separate entity from the actual hospice. So palliative care, I know sometimes it gets kind of confusing because we talk about palliative care and we talk about hospice care. And so a lot of times people don't understand the differences between hospice and palliative. So palliative care is, it's actually just like an early stage of hospice. It is still end of life care. It is still comfort care and still driven to be proactive towards quality for patients. But with palliative care, you are still able to seek aggressive treatments. So unlike hospice care, where you are electing to just do comfort care once you go on to hospice, so palliative care, you can still be on home health services. You can still be, like I said, seeking aggressive treatment. So you may be going to, the doctor, getting regular blood checks or routine checks or whatever. And so that's the kind of the differentiator between palliative care and hospice care. So, but with our palliative care program, it is actually it's a house call program. And so a lot of people back in the I would say like the olden days where the doctors came to the homes and they visited you in the home. That is really what this house call program is. So it is a nurse practitioner who comes into the home and gives supportive care to the patient and the families so that they may or may not be able to get out and go to the doctor. They may or may not be able, we're not here to replace the primary care physician. We're here to work alongside a primary care physician's office, but maybe it's very taxing to get your loved one in a car and get them to a doctor's appointment. I know sometimes, just getting them there and getting them home, that takes, all day, and it really takes it out of them. So if you had this palliative care program, it allows you to be able to get those services right in your home. So, a lot of folks do ask how this service is paid for, and it is paid for through Medicare. It is billed just like a physician's visit, just like a family practice visit, going to the doctor. You, typically do have Medicare, and there is a copay, or if you have a secondary insurance that pays for your copay, then there's no cost at all. From the beginning, like the referral process. So, anybody can call and inquire about the palliative care program. And so if you have frequent hospitalizations or anything that allows you to think that you could benefit from the palliative care program, you can actually call in and refer yourself. So we don't have to have a physician's referral for the palliative care program. What we typically do is we have one of our patient care representatives come out and visit you and just talk about the program. And we just kind of do what we call a goals of care visit. And that visit just consists of us finding out what your wishes are. What do you want to seek from this program, or what do you, what are your wishes? I know during these really uncertain and trying times of COVID, a lot of folks are not wanting to get out and go to the doctor's office or go to the hospital. And so this just allows us to be able to come into the home and provide those services for you. The other really awesome thing that's happened during this transition is that we are actually allowed to do telephonic visits. And so we can either do visits via telephone, or we can do visits via FaceTime, or we can actually do visits on app programs such as Zoom, or our staff has an app on our tablet systems that we utilize for these type visits. So if there is a nurse in the home or a nurse practitioner in the home, and they need to consult with the physician, then we can actually do those face-to-face telephonic visits, via those apps. And so that's been kind of a new change for us just since March, and going forward, until they change and tell us that we cannot utilize telephonic visits anymore. But back to the palliative care program. So after we've come out and done the initial visit where we do the goals, sit down and do the goals of care, just kind of understand where you are in the process and, really what your goals are. Then we also coordinate and collaborate with the primary care physician because, again, like I said, we do not want to replace the primary care physician. We want to work alongside them. We can provide medication management. It is a nurse practitioner house call program. So the nurse practitioner, there are some limitations to what a nurse practitioner can prescribe. And, a lot of times pain management is not something that a nurse practitioner can do a lot of prescribing for. So we have to, again, still utilize your primary care physician and or pain management for any kind of narcotics and that sort of thing. The palliative care program can be done anywhere that a patient calls home. So we can go into assisted living facilities. We can obviously go into homes and independent living facilities. Currently, at this time, we do not provide services in skilled nursing facilities. You most oftentimes can still be and may be referred to home health. So when we have a patient that's on palliative care, we may continue to use home health. We will partner with home health agencies to provide any in-home care or therapy, anything that the home health services that, either before or if we call and make the referral for those services. And that's a big difference between hospice and palliative care. So again, once you elect hospice care, you are unable to be on home health and to be on those services at the same time with hospice. So you're still able to be on both when you're on palliative care. And how often does the nurse practitioner come? So it just really depends on your situation. So it's very, case by case and designed for each specific person. So if the nurse practitioner feels that, you need to be seen every other week, or if she feels that the patient, just needs to be seen every month, then we can just put you on monthly visits. But, it's just like a doctor's visit. So if you need something in between when the last time the nurse practitioner was there and something happens and, condition changes, or, you get sick or a cold or anything, it's just like going to the doctor. You would give us a call and we're going to schedule an appointment with the nurse practitioner to get you on their schedule. And so they'll make those visits. We also have a 24-hour triage in our clinical responsiveness center that has access to all of our patients' charts. So even if you are not on our hospice program, but you're on our palliative program and something happens, say in the middle of the night, or, again, something is wrong, you can call and talk with a live nurse who works for Hospice Home Care and Palliative Care Resources, and they can walk you through, they can walk you through something that's going on, or they can go ahead and send a message to the nurse practitioner to reach out to you guys the next morning. So it's just, we do have that available for both palliative care and hospice to be able to reach our patients and be able to provide 24-hour service to them. Again, I talked about it is a Medicare benefit, and so it is paid for just like a physician's visit. As far as the length of service and time that you can be on palliative care, there's really not a time limit. So if you're familiar with hospice at all, I know, they typically say 6 months or less. So if you are, looking at hospice, they are looking that if your disease progresses on, the way that it is progressing at that time, it would be 6 months or less. With palliative care, there's really no time limits to palliative care. We like for our patients to be on palliative care for, several months. And so, anywhere between 4 to 6 months, but it can be up to, years with palliative care. It just depends on, how early you elect to get on those type services. As far as hospice goes, the thing with our hospice program, and again, most of you guys know that hospice is just an extra level care. It's a higher level of care. So your palliative care, bridges you into hospice care. And so when you're ready to elect hospice care, that is when we provide more services. So with palliative care, you get the nurse practitioner. With hospice care, you get an entire hospice care team. And so we make weekly visits with hospice. You get a nurse, a CNA, a chaplain, a social worker, and volunteer services. And that is, again, 100% paid for by Medicare. And we also can do telephonic visits with that program as well. So some of our patients, again, during this COVID times, have just requested that we do not do face-to-face visits, that we just do either telephonic visits or, again, Zoom or an app where we can talk to them via, the telephone or video chats. And so that's been a good, we have seen patients through this, and it's been a good program for us. As far as referrals, I will tell you that it's very easy to make a referral. You can either call our hotline number, and I'll give that to you. It's 501-558-4100, and it goes to like a call response center, and you can put in a referral that way. You can visit our website, and it's www.hospicehomecare.com. And if you actually go to our website, you can, when you get to the home page, there is a menu button at the top right-hand corner. You can click on that, and there's a button. It'll bring up all the menu over on the left-hand side. There's a button that says services, and it lists all of the services that Hospice Home Care provides. At the very bottom, there's palliative community resources. If you click on the palliative community resources, you can actually read all about what I had just talked about. It does give you benefits of the palliative care program, and it also gives these phone numbers that I just gave out. It has frequently asked questions. And so our website is just full of information as well if you want to just go on there and look through it. And like I said, anyone can call and make a referral for either of our programs. And it doesn't mean that you have to sign up for anything. If you just want information, we can always come out and give information. Are there any questions?
Do you have any questions? Hey, I don't know if we have any questions. Let's see what Zach has for us.
Okay.
Oh, looks like I have let's see. We have
no
questions. You did such a good job, Kelly. We have no questions.
Wow. I'm just looking through my information again just to make sure. I think I covered everything.
I think you did too. It was really straightforward and great. So sometimes, we want questions, but you did a good job. So Medicare pays for it. Anybody can make a referral, like you can refer yourself.
Yes.
You don't have to let other services go. You can still get home health care and some other services that you may see needed. You do it by a case basis.
Me too.
You don't really have to have people coming into your home as much. So it's COVID friendly, if we can use COVID and friendly in the same sentence. Um, so I think you provided a lot of great information. So again, I would say, like any other thing I would say about hospice is people sometimes wait too long and that for the service. It's a great service and it's really about quality of life. And as the general public, we should not be afraid of the service, and it really is a benefit.
Absolutely.
So,
And to piggyback off of that, just to say that that's one good thing about this palliative program, as palliative care doesn't seem as scary. It's not as scary of a word. And so it is really it's your bridge into hospice. So, like I said, a year to 6 months before you ever would even decide that it's time to go to hospice. You could even be on palliative care for 2 years. So it's never too early to call and get information about services.
yes, and I would also say to family members and caregivers, it's a hard conversation even for doctors. So that's why the ability for you to refer yourself is very important. So just know that it is just that it's a service, and you can get all the information and education you need in a phone call. We do have one question.
Yes.
Erica,
So our coverage area, for palliative care, we really have we don't have any designated lines. We can cover the entire state with palliative care. For hospice, we do have designated areas. So we have our Monticello and Pine Bluff area down in South Arkansas. We also have a Helena location. And then we have Little Rock, Hot Springs, Conway, and Searcy locations. So we cover quite a bit of the state for hospice services, and we can cover the whole state for palliative care.
yeah, and just to kind of let people know that these services are all over the state for the most part. So it's finding, if you don't have a hospice in your home care, there is a hospice service in
Yes.
the area. So
Yes. And if we don't cover, we would get you to somebody that does cover that area.
yeah, so great. Thank you so much for your time and your talents. I was really happy to see you. I haven't seen you in so long. So
Yeah.
thank you for
Good to see
coming
you.
in.
Thank you so much. I appreciate
Coming in today, joining us today. And of course, we'll have this video on our Facebook page. And if anyone has any questions or need to contact Kelly, please just let us know and we'll get you that information. So again, just to give us a kind of recap on what Alzheimer's Arkansas has going on. Of course, we do this every Thursday at noon. We always try to bring you the resources and the education you need. So as a caregiver or a professional, if you think that there's something we need to cover, please let us know. We are open. We have the virtual walk set for September the 19th. We would love for hospice to have a team, and you can send your video and pictures in, Kelly. So if you want a team, you can contact Zach or us at the office. Please visit our website at alzark.org, and you can get all the great information about what we have going on. So let's talk about some of the easy ways to contact us, because of course the cell phone is the easy way. So if you want updates about Alzheimer's Arkansas, text ALZARK to 51555. And if you would like walk information, please text RESPITE, RESPITE, to 71777. So please, everyone, have a great week, and we will see you next week. Oh, a question. What about if the person is in an assisted living facility?
We can provide palliative care as well as hospice care in assisted living facilities. So we provide both.
Yes, Margie, if your loved one is in any facility, skilled facility, or assisted living, you can get the services. Okay, so I think that was it. Thank you,
Okay.
Kelly. Thank
Thank
you, everyone,
you.
for joining us. Have a good week.
Bye bye.